Hello, 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 my friends. Jill Osborne from the Interstitial Cystitis Network with another support group meeting. Today is Sunday, December 4th. Normally, I do these on Sundays. I was not here last week, and the reason why I wasn't here is I was recovering from oral surgery, and holy hell, was that not fun. That was hard. It was very, very painful. So, anyway, I'm really glad to be back because I have some very, very interesting news to share with you. But let's just hold on tight just a minute. Let's let some people come in. Hello, Facebook. Hello, YouTube. And the question is are we going to do Instagram today? Who knows? You never know with Instagram. I'll give it a shot. Let's just see if we can get Instagram running. Okay, let's see if it's going to operate. Oh, it might. Hey, look at that. All right. Excellent. Excellent. So, guys, first weekend of the holiday season, and I hope that you will just enjoy the peace of it. Enjoy the celebratory nature of it. Decorate your house. Just have some fun. Just have some fun, right? So important to just relax. This has been a great weekend here in California because we had a huge storm come through. And yesterday, I had the Christmas lights on. I had my Christmas tree up. It was raining. It was a perfect, cozy Saturday. So anyway, now listen, my purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody telling you that this is all in your head. I don't want anybody telling you that you're damaged goods. I don't want anybody telling you that there's no hope. And I really don't want anybody telling you that this is incurable. Because remember, we don't think of IC as incurable bladder disease anymore. And our most recent AUA guidelines prove that. It is a pelvic pain syndrome for many of us. We are a diverse patient population. For some of us, there is a viral infection in the bladder. For others, there is a pelvic floor injury. For others, it is a central nervous system disorder. Yes, we all have the symptoms of frequency urgency pressure pain. It's incredibly annoying, incredibly frustrating because you think you got a bladder infection, right? You think you have a bladder infection, but you don't. The great majority of you do not have bladder infection. I never had bladder infection. Hi, Angel. Nice to see you. Hi, Ann. Nice to see you. Now, you guys, I really love questions, so please throw out questions to me, but I want to get through something first. Ann wants to know, how do you do a reverse Kegel? Reverse Kegels are really hard to describe. The way it was described, Now remember, with a Kegel exercises are done to strengthen muscle. So if you were incontinent, yes, a Kegel exercise is normally what you would do. But for the great majority of us who have pelvic pain, we don't do Kegel exercises. We have to do things that relax muscle. And a reverse Kegel tends to relax muscle. So the first thing you can think about is when you do you know how to do a Kegel. I mean, hopefully you do. The isolating your pelvic floor muscles can be a bit challenging. So the next time you go to the bathroom, as you're urinating, just stop your stream and then let it go. Stop your stream, let it go. Only do that once or twice. You don't normally do this during urination, but that will help you understand that you're working with the correct muscle group. So with the Kegel exercise, we're going to tighten those muscles. Oh, let's do it together, shall we? And then you release the muscle, right? So one way of thinking about a reverse Kegel is emphasizing the relaxation phase. So you might contract for a second, but relax for 4 seconds. And that's one of the ways that you kind of know your muscles are really tight, is that, I mean, so when I had my first pelvic floor exam, what was so interesting about that is that obviously my physical therapist had her finger in my vagina and she said, do a Kegel. Okay. I did a Kegel. She goes, okay, do it again. Did it again. Did it a third time. I couldn't tighten as well and I couldn't relax as well. Did it a fourth time. And I could totally see that my muscle was not behaving normally. So one of the things she said to me is, okay, clearly for you, your muscles are tight. So we don't have to focus on tension. We need to focus on relaxation. So what she told me to do is when you do a Kegel, contract for a second or two, but relax for 4 or 5. Just focus on that relaxation part of it. Another way that they describe it, hi Pisces, hi Gina, is opening a rose, how a rose unfurls. And I can't really describe that for you. I don't know how to describe that for you. It's, you know how a rose unfurls, right? Like that. So as you're sitting, you kind of relax into it. I'm trying. Who would have thought we would be doing Kegels in a live stream? Right? Hi, John. Hi, Marlene. Okay, hold on. Let me finish your question. Then I see we have a couple questions on Instagram too. Will Metamucil orange be a bad bit for icy? Yes. Yeah, the problem with Metamucil, there's 2 problems with Metamucil. There's 3 problems with Metamucil. Number 1, the food coloring. Number 2, the sugar. It's using artificial sugar. And number 3, psyllium husk is insoluble fiber. It's half soluble, half insoluble fiber. I mean, half insoluble, half soluble. And so for those of us who have more sensitive nerves, that psyllium husk doesn't work well for us. We do better with a pure 100% soluble fiber, which is acacia fiber, which is, do I have it? Here it is. So the acacia fiber that I love and that I use is called Heather's tummy fiber. And in fact, I just put a heaping teaspoon of this in my smoothie today. Okay. Thank you, Rebecca. Okay, hold on a second. Here on Instagram, we had focally, especially when you have endometriosis on top of that icy irritating pain. Yeah, endometriosis is, do you know the history of endometriosis? So endometriosis is a migration of the endometrial tissue of your uterine lining that goes up the fallopian tubes and out into your belly, and it doesn't belong in your belly. And the problem with endometrial tissue is every time you have a period, it bleeds. And so if you've got endometrial tissue not in your uterus, but actually in your belly, it's going to bleed, and blood in the belly actually is quite painful. Blood is meant to be in blood vessels. It's not supposed to be free flowing throughout the belly. And of course, endometrial tissue can migrate all the way up to your lungs. It can go wrap around your bowel. It can do all sorts of bad things. Endometriosis is a man-made condition. We had a very important study years ago, and I want to encourage everybody with endometriosis to join the Endometriosis Association. They are a fabulous nonprofit. And so kind of the IC movement and the endometriosis movement got started right around the same time in the late 1980s, late 1980s, before I was involved. And they were really focused on research. And they had a very, very early research discovery. And it was a small paper published in a chemical safety journal about a study that was trying to prove that dioxin, which is the most harmful chemical ever made by man, it's the chemical produced when you burn plastic. So it was a bunch of plastic researchers who were trying to say that dioxin was safe. And so they were giving dioxin to monkeys. And the monkeys started dying. And they published this paper that they didn't think anybody would find, again, in the small arcane chemical journal, which directly correlated this monkey deaths with the growth of endometriosis. And so the early endometriosis patient advocates found this study, and they petitioned the National Institutes of Health and said, before you disband the study, before you sell these monkeys or kill these monkeys, can we please do laparotomies on them to see if we can make any correlation with respect to dosage of dioxin, and is that causing endometriosis? And they did. They were successfully able to petition for that. And guess what happened? The level of endometriosis found in these monkeys was equivalent to the amount of dioxin they were given. The patients given a tiny amount of dioxin, Very little. The patients who were giving massive amounts of dioxin, massive amounts of endometriosis. So a dioxin is an estrogen mimicker. And I think back in World War II, I think that they said we had like 50,000 endometriosis patients in the world. And now it's many, many millions of women in the world who have developed endometriosis because of chemical exposures. And of course, every time it's holiday season, take note of this, my friends. Do not burn Christmas wrapping paper in your fireplace. You should not do that, because if there's plastic in it, you are now getting dioxin into your home and everywhere else. And if it gets out into the farmland, it's going to be in the grass. The cows are going to eat the grass. Then it's going to be in the milk. And then it's going to be in your milk and your yogurt and your cheese. Every year, they usually add another chemical or two to that list of known causes for dioxin. One of the critical things that the Endometriosis Association said early on, I did a great interview with the founder of the Endometriosis Association about 7 or 8 years ago, is it's very important to eliminate all extraneous chemicals out of your home. This means no oven cleaner, no scented candles, anything at all like that. No Glade plugins. We have to eliminate as many of the extraneous chemicals as possible. Here, hold on, I got a drink. I have to make sure I drink because I'm on blood pressure medication, which reduces water, and I keep getting just a little bit dehydrated. So I have to do at least 2 of these a day, sometimes 3. Let's see. Let's test my dehydration. Nope, it's pretty good. Excellent, excellent, excellent. Okay. The stress theory of Hans Selye says, has anyone ever tried small concentrations of carbon dioxide to relieve attacks of IC8? Not that I know of. I'd like to hear more about that. Angel said, started on Bladder Builder 2 days ago, started first acupuncture treatment last week, going Monday and Thursday this week. Goal is 12 sessions per suggested IC book I read. Any thoughts? Well, cause and effect, my friends, cause and effect. And so, Angel, it's important that we understand what we're trying to treat here. So if you have Hunner's lesions on your bladder, acupuncture will not heal a lesion. And we're going to talk about that in a minute because we've got very important new research on Hunner's lesions. If you have pelvic floor tension, is acupuncture going to relax those muscles sufficiently to restore blood supply? Probably not. But there's usually no harm in it. If you want to go for acupuncture, go for it. It might be a good skill to learn. It'll be interesting to see if it can kind of calm your nervous system down a little bit. I will tell you, for me, I'm IC subtype 5 central sensitization, along with IC subtype 3 pelvic floor driven. I could not tolerate whole body acupuncture. It was too much stimulation for me. But go for it, hun. Angel, go for it. Okay. Let's see here. Sylvia says, I have IC with Hunner's diagnosed in 2003. I've had all lines of conventional and unconventional treatment. I've had them burn on my bladder well over 20 times while doing a hydro, to only find they return as little as 2 weeks. However, the amount of, let's see. Okay, so Sylvia, this is for you then. So what crossed my desk, my desk last night? I always work very, very weird hours. And so here it was 12 o'clock last night, or 12:30. And I just was browsing through some of the research to see if I could find something that we could talk about today, when, bam, we have a new study which has correlated Epstein-Barr. The Epstein-Barr virus, which is a variant of the herpes virus. So if any of you have had mononucleosis, that's Epstein-Barr. So we have a new study that from Asia, from Taiwan, which has correlated Epstein-Barr Hunner's lesions. Now, this isn't the first time we've made a connection between a viral infection of the bladder wall and hemorrhagic cystitis and Hunner's lesions. We knew 6-7 years ago, Europeans who were studying Hunner's lesions kept finding a different virus in urine. in patients with Hunner's lesions, but not in patients without lesions. And we have long known that viral infections occur in patients who are immune compromised. And there's a long history of viral infections infecting the bladder wall. Of course, you all think a bladder infection is bacteria. It's not necessarily. For some of us, it could be viral, and for some of us, it could be fungal. So what was interesting about this study is that they were looking at specifically at Epstein-Barr genes, Epstein-Barr DNA. And it's a very, very academic study. If I read it, you're just not going to get it. But I will just tell you. Let's see. So in this study, they detected Epstein-Barr latent infection genes. 1, 2, 3, 4, 5, 6 genes that were being expressed that are directly correlated with Epstein-Barr infection in patients with Hunner's lesions, indicating the coexistence of Epstein-Barr virus, persistence, and reactivation in Hunner's IC. And then they go into Epstein-Barr associated inflammatory genes, and y'all don't need to know that. So this is big. Because again, as we were just seeing, oops, here, hold on a sec. As we were just seeing here, there are some patients who have recurring infection, recurring lesions over and over and over. And the question is why? Why is that happening? And for some of you, there is no doubt that there could be a viral infection happening in the center of that lesion. You know, lesions are a separate and unique disease. Everybody in the world agrees. Every researcher in the world agrees. Patients with Hunner's lesions are extremely different than patients with me. Patients who have pelvic floor dysfunction or pudendal neuralgia or estrogen atrophy or chemocystitis. Patients with Hunner's lesions are their own unique disease. And the reason why we say that is because when we biopsy a lesion, there is biological warfare happening in the middle of that lesion. There's massive inflammation happening in the center of a Hunner's lesion that is not happening in the rest of us. If they biopsy the bladder of a patient with estrogen atrophy or a patient with pelvic floor dysfunction or a patient with chronic overlapping pain conditions, they don't have the inflammation. The only patients who have that massive biological war happening is the patient with Hunner's lesion. And so the question is why? What's the war about? Well, so it was the Europeans who found polyomavirus. They were the first ones who made a very direct correlation between viral infection and Hunner's lesions. Our government was remarkably quiet about it for 5 years, and I was baffled. Why are you so quiet about it? This is so big to discover that Hunner's lesions could be viral infections. Turns out they were doing their own study, and yes, they did also find virus in about 5% of IC patients, which is similar to what the Europeans found. And so, and of course, Hunner's lesions cannot, with our two theories of Hunner's lesions is number one, it's viral infection. Number two, it's neuroinflammation, that we have a nerve that's massively inflamed that's causing the lesion in the bladder wall. Well, what lives on nerves? Viruses. That's where they stay. That's why we get recurring cold sores and herpes, because the virus goes latent, it lives on the nerve, and then something turns it on. That's shingles. Same thing happens with shingles. So I think what I would say to you is, number one, Sylvia, have you ever had mono? And number two, what I will do is I will try to write a blog on this and cite the research so that you can share that with your doctor, because I think given how often your lesions recur, you need to have a viral test. I think it'd be very, very important to have a viral test, because then they can try some antivirals. Okay. Hi, Kayleen. Hey, girl. So with respect to new treatment, the new treatment for Hunner's lesions, so Hunner's lesions are generally going to be treated with cauterization, which you've had, steroid injection. You don't say you've had that, but that's important. Steroid injection reduces inflammation. Number 3, hyperbaric oxygen therapy. And then I think antivirals, we're going to be adding that to the mix sooner rather than later. It's just the research is very scattered around the world, and so we need to combine it. So, hey, Barbara. Angel, I wonder if these, quote, rare cluster cells are COVID virus or EBV. Urologist wants to do another cysto in the end of January. Well, if your symptoms began after COVID infection, then the answer is, yeah, it's either massive inflammation caused by COVID, or you've got a little cluster of active COVID virus in your bladder wall. And we have research that has found that. Sylvia lives in North Georgia. Hi, Paula. Rebecca, I'm one of the people who started out with a bladder infection. This was a post-sex infection. No prior bladder issues. Here, hold on. No prior bladder issues or infections, several rounds of antibiotics, and symptoms never got better. What do you think happens in these situations? I haven't had an infection since then. That was 6 years ago, and I'm feeling so defeated. Well, again, when we think about subtyping, Rebecca, we have to very clearly accept that there's tremendous diversity in this patient population, right? So we've got, again, patients with Hunner's lesions, patients with chemocystitis, patients with estrogen atrophy, patients with pelvic floor, patients with pudendal neuralgia, and patients with central sensitization. And it was interesting. I was working with a patient this week whose symptoms began when she was a teenager. And normally, when we see this begin in somebody that young, we're always looking at injury. That there is a series of minor injuries over time, especially if you're a gymnast, football player, ice skater, a little falls here and there and there and there. They don't necessarily give you symptoms, but they begin the process of damaging muscle. They begin the process of tightening muscle. And then there is something that happens where a straw that breaks the camel's back, that turns all the latent muscle trigger points on, and then we start getting a lot of bladder irritation. So, concept number 1 is it just may have been the straw that broke the camel's back, that you already had something else that was just slowly building over time. The other thing that I would really want to know is your age, Rebecca, because remember that as estrogen levels drop, our skin loses its ability to protect itself from infection. And so is it possible that you were on a new birth control that was really reducing your estrogen levels? You've been on Lupron, or you were perimenopausal or menopausal, or you'd had a hysterectomy where your estrogen levels just dropped, drop. Your skin got drier, and bam, it is now vulnerable to infection. And so the estrogen atrophy would have potentially been the cause of that first infection. What do you think of that? Does that make sense? Now you guys hit me up with questions. Hit me up with questions. The other thing, Rebecca, I'm just going to throw this out too, because it started after sex. And, we certainly know that I see patients, pelvic pain patients, flare with sex. The question is, why do they flare with sex? Well, for many of us, it's pelvic floor driven. It's very common for a woman to have a pelvic floor flare that begins about 6 hours after they have sex. It will last 24 to 48 hours because their pelvic floor gently spasms over that period of time, which I think is built in to help sperm meet egg. Whereas for a man with pelvic pain who has sex, their worst moment is the moment that they ejaculate, because that is when their pelvic floor goes bam, and that really locks it down tight. And that's one of the very interesting differences between men and women. It's just important that you understand that we all think it's infection at first. The bladder only has one way to tell you that there's a problem with the symptoms of UTI: frequency, urgency, pressure, pain. A bullet wound would feel like infection. A stab wound would feel like infection. Cancer would feel like infection, because the bladder only has two nerves: a nerve that controls frequency, urgency, and a nerve that controls pain. And so every single one of us, when our symptoms began, we all thought it was infection. The challenge is that the cultures usually come back negative. Oh, it's complex, right? It's like peeling an onion. They're just layer after layer after layer, and that's what we want to do. We don't want to chase your symptoms. We don't want you to spend 5 years chasing your symptoms. We want to figure out what the underlying cause is so we can fix the cause to make you better. Let's see. Katie says, I also have Hunner's lesions and I'm so frustrated with the treatment. I have my 5th hydrodistension. You know, Facebook is driving me crazy here. Hold on. It keeps throwing, here, I got to pop out my discussion on Facebook. Hold on. Move to new window. Okay, that's better. Then maybe it won't. It kept scrolling it all the way back up to the top. Katie says, I also have Hunner's lesions and I'm so frustrated. Honey, I hear your pain. I feel your pain. I totally understand. Oh, you know, we have our challenges here, though. I will tell you, we certainly have challenges here in the United States because, unlike Europe, although it is an issue in Europe too, American urologists really are not trained well on how to diagnose a Hunner's lesion. In fact, 2 years ago, we had this beautiful atlas, for lack of a better term, with all these pictures of what Hunner's lesions look like for urologists so that they really could find them correctly. Because what we found was some urologists were diagnosing Hunner's lesions that were not there. You know, they were just, and then others were missing them completely. And then, of course, you also have to understand that, you know, when your doctor went to medical school is important. One of the fascinating conditions is called trigonitis. The trigone is a small, distinct area of skin in your bladder that incorporates your ureters and it goes down to your urethra. The trigone has different cells in it. It's actually, I think, more hormone sensitive. But the trigone can also be bumpy. There's a condition called trigonitis. Is trigonitis real? Is a bumpy trigone a sign of disease? And so we had a lot of doctors who found these bumps who would just laser them off. And I remember when I started the IC network and I was researching all of these other conditions because we needed to have, you know, depth and breadth of all the things that could happen. And the great majority of urologists were saying, that's pointless. It's okay if the trigone is bumpy. Don't assume that that actually is a sign of disease. Andrea says, I can't stand the pain. Andrea, honey, are you struggling with are you struggling with incontinence too? Marcia says, I've been feeling better and better and decided to have a pre-Christmas splurge at Starbucks energy drink. Girl. No. Oh, honey, it put you in a 3-week flare. You spent a fortune on your compound cream with lidocaine. Oh, okay, Marcia, girl, we've all done that. We've all done that. We have all made mistakes like that. And This week, we did a drop-in meeting on Facebook, but on the day before, I was working with an IC patient, was she newly diagnosed? No. She'd had symptoms for quite some time. And she hadn't done a lot of reading. And so she called and we were kind of going through all of the subtypes. And, some of you it's like just getting information from you is so hard. It's just so hard. So I'm like desperately asking questions. When is your pain the worst? When is it the better? Is it to the left? Is it to the right? All this sort of stuff. And I'm in my head as we're talking, I'm going, okay, I think she's pelvic floor and maybe central sensitization, like maybe, right? And I made the mistake. I didn't ask her what she drank every day. Normally, when I go through subtypes and bladder wall, I go, okay, do you drink coffee or soda or anything like that? And she volunteered that she was addicted to energy drinks. And she was drinking 3 energy drinks a day in the morning. And that completely stopped everything else. And it was like, okay, you're a chemo patient for sure. You're a chemical injury patient. The bladder, our bladders were never designed for energy. The single worst drink you can drink by far is an energy drink, guys. Don't do it. If you want to go to Starbucks and have a treat, get a peppermint cream. Do a vanilla cream. They can put some peppermint flavoring in. They can put vanilla, cinnamon dolce in it. They can put any of the other flavors in it. But Marcia, listen, girl, I've done it too. We've all done it. No shame, no blame. It's just a good reminder to everybody that we want to have a nice holiday. So this is not the time to go way off of your diet. Wait until after the holiday. Like if you're expecting to have Christmas with family and friends, we don't want you to be sick for that. We don't want you to be flaring for that. So hold off on your cheat until New Year's Eve when you're home, or New Year's Day. And just be prepared. You got to have your flare management tips. You got to know what you're doing, right? Mary says, can I ask when the ebook for meals would be sent? It is immediate, honey. When in your receipt, there's usually a download. There's a download link with your receipt. So if you didn't get it, Mary, do me a favor. Email me right now, icnetwork@map.com. icnetwork@map.com. Send me your email address and I will personally email it to you today. I'll email it to you during the meeting if you email me right away. Okay, here on YouTube. Rose said, I'm really wondering if my bad UTI caused a pelvic floor issue that's causing my urethral pain. Well, anytime you're in pain, your muscles will get tight to protect you, right? And so if you have a super bad UTI, your pelvic floor is going to lock down really tight. There's no doubt about that. But as your UTI is treated, everything should relax. If you feel like you're trying to pee through a needle, that's your levator ani squeezing your urethra. So that could be a source of urethral pain. However, another common cause of urethral pain is estrogen atrophy. So, Rose, how old are you, hon? So she said the last time she was on here, she was having urethral pain after a bad UTI. You brought up your Skene slant to the urologist. He ignored the idea. I go to the urogynecologist on Wednesday hoping for some answers. So I have a really good blog on the IC Network website, the 7 causes of urethral pain. And one of the things we talk about is the periurethral gland. So your urethra is like the size of your little finger. Okay. It's for a woman, it's short. So we're talking, so John, bear with me here. You know, I'm talking about women right now. So our urethra is really this short. And like the male prostate, women have a prostate gland. We do. It is a homologue. It is identical in structure and cellular structure to the male prostate gland. For us, it's halfway up the urethra and it's around the urethra and it's kind of like a sea sponge. It's like literally right here. And like the male prostate, it can get infected. And like the male prostate, it can get blocked because the drainage ducts are super, super, super tiny. So Rose says, well, how would you know if you have one? Well, it's really easy. It's really easy to figure out if you have one. All you need to do is wash your hands really well, really well. If you've got gloves, use gloves. Put some KY on your finger. Put it in your vagina. Now remember, okay. So here's your urethra. Here is my finger that I'm inserting in my vagina, right behind it. And you're just going to rub about an inch upwards. Rub on the front side of your vagina, just like this. And if you feel like a pea-size lump that is painful, it feels like a deep pimple. You know how you get a pimple and it's like under the skin and it just won't, and it's like really painful, but you can't pop it because it's so deep. That's exactly what an infected periurethral gland feels like. So again, if you stick your finger, so here's my urethra. I'm sitting on the toilet. I'm going to, with a gloved, washed hand, a little bit of KY, I'm going to stick my hand in my finger in my vagina, not far, just like an inch. And I'm just going to rub like this on the front side, because your urethra is in front of your vagina. You don't go along the back side, you go along the front side. So if you don't feel a lump, hon, then you don't have infection. That's the way periurethral gland infections present. On the other hand, if you do, when you go to the gynecologist, you're going to say, all right, so I have this bump here that doesn't belong here, that's quite painful. Can you please tell me what that is? And get them to look at that. And let's see what they have to say about that, right? That was literally the very first article I put on the IC network. It was on the female prostate, and it was done out of UCLA. Alexa says, I'm still trying to figure out what the hell is going on with me. I ended up in the ER before Thanksgiving. My symptoms were aggravated. No UTI, but they found bacterial vaginosis. So now I'm wondering if this has been my issue all along. I had an infection, but I was tested for BV back in July and it was negative, but I also had taken 2 rounds of antibiotics. Well, honey, the proof is in the pudding. If you really believe that you have infection, get a next generation DNA urine test. It'll tell us for once and for all if it's good bacteria or bad bacteria and what's going on. You know, it's about data. See, the thing is you guys, we're long past the days of thinking that this is an incurable bladder disease. We are long past those days. We do not want you to go to the doctor and accept a doctor saying, hey, this is IC, it's incurable, you got to learn to live with this. This is your life. Now we're going for causation. We're going way beyond that. And that's not me, that's the American Urology Association. That's what they're telling doctors to do. And ultimately, if you don't let the doctor do testing, you are forcing them to guess, and you deserve more than a guess. If you've been in pain for 3 months, 6 months, 9 months, whatever, at some point in time, you want them to study you a little bit more. Whether they want to look in your bladder and see if there's something structurally wrong with your bladder, but certainly ruling out infection is important because so many of us cling to that. It's infection, it's infection, it's infection. And I hate to break it to you, but for the great majority of us, it's not. Our biome is a normal biome. That's what the research studies show. But the one way to prove it once and for all is with the next generation DNA urine test. So go to bladderhealth.org. That's a website I built dedicated to this, bladderhealth.org. And you can watch a bunch of videos of doctors who use it. It's really used by infectious disease specialists. It's used, all the COVID testing is done this way. It's the future of care. Dr. Curtis Nickel, the top IC researcher in Canada, gave the keynote speech at AUA 2 years ago where he said, listen, This is our future. We're not going to be doing urine cultures too much longer because they're not as specific as a next-gen test. And a next-gen test can also identify fungus and even virus potentially. So that's what I would do, Alexa. That's what I would do. Let's get the facts now. No guessing. Have the test done, and let's see. Rose said, can someone just randomly develop interstitial cystitis and its impact on the urethra only? I've never felt bumps when I checked. Interstitial cystitis is not characterized as urethral pain. Interstitial cystitis is characterized as pain on bladder fill that is relieved by urination. So if you have, the fuller your bladder gets, the worse you feel until it's like, oh my God, it hurts so bad, I need to find a bathroom. And as soon as you pee, you feel better. That is the de facto diagnosis that there is a problem with your bladder wall. Interstitial cystitis is not correlated with urethral pain. There are a lot of other things that are correlated with urethral pain, like tight pelvic floor muscles, and especially estrogen atrophy, chemical sensitivity. It could be something as simple as new laundry detergent irritating the urethra, any of those things. Rose has said, I've had all the tests, cystoscopy, MRI. Nobody can figure out why my urethra hurts. I have pain after my pee. So, okay. So Rose, here's an interesting story. This is, honey, this is something. So I was working with a patient a couple of years ago who was just like you. Man, she just had, all she had was urethral pain. And they diagnosed her with interstitial cystitis. She went from doctor to doctor to doctor. And she did all the bladder treatments. Nothing helped her. Nothing helped her. And they weren't listening to her until she finally went to a new doctor. And believe it or not, it was a nurse practitioner who said, wait a second, your pain is only at your urethra. And she said, yes. And the nurse practitioner said, let's do a CAT scan. Let's do a CAT scan. And the CAT scan found it. She had a urethral diverticulum. A diverticulum is a pocket. It's like a little piece of tissue, like a little balloon that comes off of the urethra. And so here was her urethra, right? She had a diverticulum that was as long as her urethra, and they were connected by a tiny tube. So what was happening was that urine was collecting in this pocket, and that was causing a lot of her issues. So they were stunned when they found a diverticulum. And I think that the new AUA guidelines, I think, even talk about looking for that. That's flickering in my brain. So anyway, what they did with this patient is they surgically cut it out. They just sealed the entrance and they pulled it out, and she's a complete cure. So Rose, again for you, we have to kind of look beyond the normal. Now you say you did have a CAT scan. Crap. We should talk on the phone, hun. Rose, if you can, give me a phone call this week. We should talk. Because I can try to do some more digging for you. I mean, is there a chance that, is your pelvic floor so tight that it's squeezing your urethra? Is there a chance that you have endometrial tissue that's kind of wrapped around your urethra? Is there a chance that another patient that I worked with, who's actually a good friend, was very, very interesting because she suddenly became incontinent. And it was just like, one day she was fine. The next day she couldn't hold her urine at all. And when they went in and to fix that, they found that she actually had a birth defect that they fixed. Honey, it's right on the front page of the IC Network. Just go to our website, icnetwork.org. It's right on the front page. On our contact page. It's an 800 number. Just don't call too early. I really don't start working with patients on the phone until afternoon because I'm doing elder care in the morning for my parents. And Mondays are usually my day off. So Tuesday later, and I'm completely open this week. Completely open this week. All right, Instagram. Hold on. Have I missed a question? Hi, Filski. Hi, Hedge. Sai said, I had a UTI. I thought it was an IC flare, having flank pain on Keflex. Best way to tell if it's a flare or infection. Infections cause fever. IC does not. And actually, hun, here you go. This is our latest magazine. And I wrote a whole blog, a whole article, UTI flare, how to tell the difference. And so you can start with the dipstick test. If your dipstick test comes out positive for nitrites, then you have infection, because nitrites are only made by bacteria. If that's not indicative, you can always have urine tests, et cetera, et cetera. But anyway, I've got a whole article on this in our latest magazine. And I actually think it's on the IC network as a blog too. Rose, I'll stick our number in here. I answer the patient support line and the corporate office. So that's our 800 number. And that's my direct line. Okay. And it's first come, first serve, guys. So a lot of you call and you get right to me and you're surprised I answer the phone. Yeah, I do. I don't have a secretary. And for others, you have to leave a message and I'll call you back when I can. I've got 3 messages from last week that I have to return tomorrow. So I do my best. Okay, Rebecca said it happened at 56. So Rebecca, the fact that your symptoms, you had your first UTI at 56 points directly to genitourinary syndrome of menopause. And that's where you are. You know, your skin just got so dry that you finally got an infection. If they treated the infection, but the problem is your skin's still dry. Your mucosal barrier in your bladder is compromised because of the loss of estrogen. That's what's going on. And she says she hasn't had a lot of improvement with the estrogen. She was hoping it would. I really appreciate your all ideas. Your first culture showed it was severe infection. Yeah, but cause and effect, hon, cause and effect. Yeah, you had a severe infection. Why? Because of your age and you were in estrogen atrophy. Anytime you have infection, it damages tissue. You get tunnels in your bladder wall as the bacteria burrows into your bladder wall. And that's why it really takes like 6 to 8 weeks for your bladder wall to heal after you've had a severe infection. But the other thing we want to make sure is, do you have one of the superbugs? Do you have a drug-resistant infection that is still living in your bladder because the antibiotic you took can't kill it? God, my neck is tight today. And so normally they would do a follow-up urine test to see if you do. Ugh, my neck is so tight. My goodness. Hold on. Little neck therapy. And it's always my right side. I have a trigger point here. I have a trigger point in my neck that's like the size of an almond. I had it since I got whiplash. I got rear-ended 40 years ago. And it just will never go away. Mary says, the solution to menopause bladder issues is estrogen, but estrogen gives me yeast and more burning and PMS pain, so I don't understand. Does this mean you could have too much estrogen? Well, this is kind of a new area. There's a, especially in the last year or two, doctors are starting to combine estrogen with testosterone as a cream because they want to do a little bit more nuanced hormone balancing. Estrogen by itself would not give you yeast, but I mean, it's an interesting mechanism of action. So the question is, well, here, and you say, and it gives you more burning. Okay, that makes sense. If your skin is super, super dry, anything you put on it, including estrogen, is probably going to burn. You have to ride through the first couple of weeks of estrogen to get past that, because every time you give that skin estrogen, it starts to plump up and produce mucus. So think about a raisin, and you put a raisin in water and it just slowly fills out and plumps up. That's kind of what happens to cells that are in estrogen atrophy, is when you give it estrogen, they kind of plump up and they get better. And they start to produce that nice thick coating of mucus that we need. Are you testing positive for yeast every single time? Or does it just feel like yeast? Dawn says, more on pudendal neuralgia. I find I can calm down the muscle spasm in my vagina with a wand, but I can't get it to stay calm. Dawn, so that's like, thank you. Thank you. Exactly. You are facing the conundrum that many of us face. And that is, why do our muscles go back into tension? And they go back into tension because we're sitting too long. We might be going up and down a lot of stairs, or you might have a pre-existing condition, or maybe a bad hip or a bad SI joint that is forcing those muscles to go back into tension. And so as you're working with a physical therapist, if you are, you always want to ask, are my muscles going back into tension, or are they slowly but steadily improving? If you're going back into tension, then we have to look at bones. We have to figure out, is there anything else going on with bones? Like literally, do you have one leg longer than the other? Marcia says, I have to go back to zero and pay attention to what I eat, upping my estrogen cream to 2 syringefuls a week. Doctor said that's the only way to improve my bladder. I just can't worry about cancer. Marcia, all the research shows that topical estrogen really does not come with a cancer risk to any great degree. Hold on. I'm losing battery on my cell phone. Hold on. Oh no, and I just got my magazine wet. Darn it. Where's my charger? Hold on. Ah, there it is. Ah, okay. Hold on. You guys keep me hopping. All right. Oh no, a software update is required to connect my iPhone. Oh my God. Okay, sorry, not now. All right. All right. So my friends on on Instagram, you guys, you're at 20%. I don't know how long that'll last. Sorry about that. Because we can't do a software update. Otherwise, I have to stop the stream. Okay. Laquette says, pelvic pain I had was from adhesions on the bladder that caused pain. Yep, exactly. I'm glad they found it, because obviously something like Elmeron would never have fixed that. So I'm really glad they found that. Mary says, my gyno-neurologist said cancer does not cause pain like this. Now confused. Well, I mean, the bladder only has 2 nerves, frequency urgency nerves and the C fiber pain nerve. Infection, but I'm in a lot of pain. I don't know if it's pelvic floor, tight muscles, vulvodynia, a fatigued episode for at least an hour after I peed. That's weird. Caleb, really? I have IUD strings. Check appointment on the 15th, though. I hope this isn't endo sneaking up. Well, girl, you just got to do what you do. If you think it's tight muscles, use your heat. If you have a muscle relaxant, use that. And let's see if that makes it a little bit better. Katie says, so scared. Been putting off for 3 years. It just feels wrong. Katie, what feels wrong? What's the thing called between the end of the bladder and the urethra? The sphincter. There's a sphincter. Bladder neck, maybe? I always get that confused. Alexa says on YouTube, I was here. Hold on a sec. God, I hate it when I can't remember something. I know I do pretty good for my age, but okay. So it's a sphincter and or also known as the bladder neck. The muscles tighten to hold urine in the bladder and relax to release it through the urethra. Urinary problems occur when abnormalities block the bladder neck and prevent it from opening completely during urination. And there's something called a high bladder neck. And let's see. So I don't quite understand a high bladder neck elevation, which indirectly reflects prostatic urethral angle, can be a cause of bladder outlet obstruction. All right, well, anyway. When I say chemo bladder, I mean chemical irritation to the bladder, whether it's from chemotherapy or if it's from drinking too much coffee or soda or green tea or anything at all like that. Mary says, can atrophy cause IC? Yes, but IC doesn't mean anything. They're not going to be using the term IC in Europe much longer. It's pelvic pain. So don't get stuck with the name. Don't get stuck with the nomenclature of the name, okay? It doesn't matter if it's IC, bladder pain syndrome, painful bladder syndrome, hypersensitive bladder syndrome. It doesn't matter. You have pelvic pain. And now we have to figure out what is causing that pain. So IC is not a disease anymore. We don't think of it as a disease anymore. And that's from the latest AUA guidelines released last June. It is a pelvic pain syndrome, usually of a neuromuscular disorder. But can atrophy cause the bladder to be more painful? Yes. Because that nice thick coating in your bladder that normally protects your tissue is estrogen dependent. So as your estrogen levels drop, your bladder starts to lose its ability to protect itself. It gets drier, just like your vulva gets drier and your vagina gets drier and your mouth gets drier. So does your urethra and so does your bladder as we get older. Mary had a hydrodistension on the 4th of this month or last month. My bladder is the worst she has seen. It was inflamed, bloody, angry. The bladder started bleeding at 200 ml. She could only do 350 and injected Kenalog. I'm marking into your Hunner's lesion, then cauterize the bleeding. She wants me to see a urologist to see if this is related to my chemo. Do you know of anybody with this issue? Yes. Cystitis is well known to damage the chemotherapy, well known to damage the bladder wall. That's why it's called cystitis. And there is, depending upon the type of chemo you're having, some forms of chemo are very irritating to the bladder wall, others aren't. There is another medication that you can take called Mesnex, which breaks down. See, the chemical injury to the bladder occurs when the chemo meds are broken down. It's a metabolite of the chemo meds. It ends up scouring the bladder and damaging the bladder wall. But you can take a medication called Mesnex, Mesnex, and that stops that from happening. So chemotherapy, well known to damage the bladder wall. It's called cystitis. Thank you, Mary. I did see it go through. Debbie says she just found out she has a UTI and is on antibiotics and she thinks it's a prevent product. Exactly. Hi, Sue. Yes, I'm wearing a flipper now. So you can't see that I'm missing this too. And Sue says she could really use some prayers and on the anniversary of her father's death from COVID and her COVID. Honey, you know what this is? The hug. Hug, hug, hug. Sue, hug, 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 hug. Oh, girl. one of the, we all grieve in very, very different ways. And what is grief? Grief is love that has nowhere to go, right? Grief is the love that we feel in our hearts for somebody that we've lost, and we want to share it, but we can't. I lost my beloved Aunt Shirley, who was like my fairy godmother, earlier this year. And obviously, I'm caring for my elderly parents, and I know that that's going to come soon, right? The best way that you can honor your dad is to think of something that was important to him and honor and do that for him. So if your father believed in helping the homeless, or if he believed in caring for animals, or anything at all like that, one of the best ways that you can honor his legacy is do his work. Take a day and do his work for him. Whether it's a garage sale and you use the money and donate it to something that was important to him, think about that. Just think about that, and write him a letter. Write him a letter and tell him how much you love him and tell him how much you miss him. But he's there. Like, I believe in guardian angels, so I totally believe he's with you right now. I do. Becky says, for me, the estrogen atrophy feels like yeast. Exactly. Because the skin is dry. The skin is just very dry. And so anything you put on it is going to cause superficial irritation of that skin, and that feels exactly like yeast. Becky says vaginal estrogen even has a lower cancer risk than oral. Oh, by far. And all these things have less than 1/10 of the estrogen that birth control pills have. Nobody connects birth control with cancer risk. Very good point, Becky. Very good point. Hedge says, my daughter has been suffering with IC for about 10 years. She's diagnosed with long COVID. She totally makes her own food. She stays on a regimen strictly. She has not worked for 16 years. Can she get disability? Well, it depends upon the type of disability. The IC Network has a disability resource center. Social Security disability is a paid insurance program. You have to have worked, you have had to earn credits, usually 40 credits. You get, quarters. If you work for a year, you get 4 quarters. So you need to work for roughly 10 years to be qualified for Social Security retirement, Social Security disability. But for disability insurance, you also have to have worked within 10 years. But there are ways of bypassing that. And so she's going to have to go to the Social Security website and see if she's qualified, call them, talk to one of the service representatives, and let's see. I had one patient in San Diego years ago who also, she waited and waited and waited and waited before she applied. And she caught it within 2 weeks. If she'd waited another 2 weeks, she would have lost her disability insurance entirely. So there's an endpoint for Social Security disability. Now, there's also supplemental security income. That is for people who have not worked, usually for people who are blind, who are profoundly disabled, have been unable to work in their lifetime. And that's the benefits are very, very low on that, but that's an option. Don't forget that we also have state disability insurance in many states in the United States, but that too requires that you work and pay into the system. Okay, let's see here. On Instagram, honestly, I can't even tell how many people are in here or if anybody's in here at this point in time. I'm sorry. Hey, thoughts. Hedge says she keeps getting kicked out. I don't know why, hun. I don't know why. I'm sorry. Hi, Kristen. Hi, Dr. Totten. Hi, Dr. Totten. Hedge says, is IC passed on in genes? Well, the research on any genetic connection was done at the University of Maryland by Jack, Dr. Jack. What is his last name? He's long retired. that data was not particularly compelling because there were identical twins, one of who had IC and one of who didn't. Now that we're subtyping, we can see a much better, we have a much better understanding of what could be passed on. And so Hunner's lesion, viral infection, well, you could be infected with a virus as an infant, possibly, but that's not a genetic, that's not hereditary. Bladder wall driven, not hereditary. Pelvic floor injury, not hereditary. Pudendal neuralgia, not hereditary. Of course, there can be birth defects, but what can be inherited is a very sensitive nervous system. Hello, redhead. Every woman in my family on my mom's side has very sensitive skin and a sensitive bladder. Are we, quote, typical IC patients? No, we're chronic overlapping pain patients. We have a sensitive nervous system. So we don't just have a sensitive bladder, we have a sensitive bowel, we have a sensitive, we have sensitive skin, we have a sensitive sense of smell, all that sort of stuff, which shows signs that we have passed down in our lineage more nerve sensitivity. And, you know, listen, being sensitive is not a bad thing. It's very sad that sensitivity has been weaponized. People say, oh, you're just sensitive, get over it. Well, you can't get over how you're built. You cannot get over how your body is built. I have been sensitive from day one. I was never able to use bubble bath when I was a kid. I was never able to wear wool. And I'm now 62 and my sensitivities are still there. They've never wavered. I am a redhead. I structurally have more nerves. Then that's what the research shows is redheads have quantitatively more nerves than people who don't have red hair, which is why my dental surgery was so difficult, right? Hi, Nance. My daughter is diagnosed 10 years ago. Oh, here, hold on. Okay. Filski says she can't hear. No sound out of your mic. No sounds. Uh-oh. Okay, I don't know what's going on with Instagram, but it's gonna. You can come on over to YouTube. Because we're simulcasting on YouTube, or you can come on over to Facebook. Okay, but I'm gonna shut Instagram down because it's not working. All right, Instagram's done. Let's put this one away. Water break. Sue says, my doctor told me to use estrogen cream, but I really didn't think it would make a difference. I finally gave in and used it. It really does help. Exactly. Mary said, if I have atrophy, would a hydrodetention be a good idea? It's crazy to me. I've been intolerant to estrogen and instills. No help, but this makes no sense. Well, again, Mary, listen, hon. It's not that you're intolerant to estrogen. It's that your skin is so dry. Anything you put on it, including estrogen, is very, very irritating. And the thing is that every subsequent time you use it, your skin gets healthier and healthier. So that initial burn usually goes away after like 2 weeks, right? So don't confuse that skin irritation with intolerance. That just means you're dry. Estrogen atrophy wouldn't cause a discharge. That's irritating me, though, regarding the yeast issue. So, Mary, they can do a next generation test on your discharge. Also, I had it done. If you want to see, you know, if we want to really see what's going on down there, a next generation DNA urine test is the way to go. They can do that of a vaginal swab. Here, hold on. Watch our December 4th IC support meeting here. You know, it's really amazing the number of people who watch this afterwards. I get so many phone calls. I watch your Sunday broadcast. Very cool. All right, so here, let me just get this started. Sorry, guys, give me a moment. All right. If I do a software update, I'm going to slow down the stream. So we better not do that. Okay. All righty then. Pamela says, have you ever heard of this being responsible for any numbness in the feet or legs? Yes, honey. If you have super, super tight pelvic floor muscles, that is, or if you have ruptured discs in your back, that's definitely going to squeeze nerves in your muscle and or legs. I wear a knee brace. See that? You know you're getting old when the first thing you put on in the morning is a knee brace. Even before my underwear, I put my knee brace on. Why? Because I have pins and needles and numbness around my knee now from ruptured discs at L4, L5 in my back from 2 years ago. And if I compress the nerve, it goes away. If I don't have it on, it gets much worse. So if you have tight pelvic floor muscles, that can certainly affect your feet or legs, and or if you have ruptured discs in your back. Sue says people are afraid of estrogen because of the cancer risk. Definitely, of course. Of course. Alexa says maybe Premarin messed with my pH and caused BV. No, you're more prone to BV because you're older and your pH has changed in your bladder. The estrogen didn't cause that. That's just life. That's just getting older, right? Rose said, can you recommend any good coffee substitutes? Yes, it's my favorite thing in the world. Where is it? This, my friends, this Dandy Blend. Love, 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 love. 100% recommend, endorse, support, encourage. Dandy Blend herbal coffee is absolutely the best coffee alternative on the market. I drink it virtually every day. In the summers, I drink it all day because I make frappuccinos with it. There's no acid in it. There's no caffeine in it. And yet it tastes very close to coffee. It's fabulous. Dandy Blend. You can get it in the IC Network store. ICNsales.com is our shop. So if you buy it from us, you're also supporting these chats, and that would be great. All right, so hold on a second here. We're having a little issue. All right. Becky says, I get thick white stuff with estrogen atrophy. I don't call it discharge because it doesn't really come out on its own, but it's inside. I thought I had yeast for years, and you kept testing negative. Weird. I mean, we're all different. It's not that the estrogen atrophy is causing it. It's probably more that you've got just a little bit of benign vaginosis going on that's producing more of this. Pamela says she seldom catches us live. It's usually replayed. Yeah, usually on Sundays, but also on Facebook on Thursdays or Fridays. Pamela said, I've had emergency spinal surgery a year ago, but the testing is not showing neuropathy. I've broken. You fractured both feet and fell so often, but now we don't know what's causing it. It's tricky. Pamela, you're not the first. I swear, I worked with another patient who fell and broke both ankles and was struggling. I would want to know what's going on with your muscles, because whenever you have surgery like that, whenever you're in pain like that, your muscles lock down tight. So I would want to know what the health of your pelvic floor muscles is. Have you had a pelvic floor assessment? That would be very interesting to ask for. Because if your muscles are tight, that's just going to perpetuate your symptoms. All right, mouse, my mouse is, stop it. Bobby says, can tight pelvic muscles cause ilioinguinal nerve pain on the pubic bone? Probably, possibly. I think that's a good question for your pelvic floor physical therapist. It's quite possible. Charlie says, have I had any experience with dry needling for IC symptoms? My physical therapist did this at our last visit to my lower abdomen and rectal pain, all external. Dry needling is a technique that's used for tight pelvic, tight trigger points. It's a valid technique. It works really well for people who have long-term persistent trigger points. So I don't see any issues with it. Sue says, is a Dandy Blend actually coffee, or is it something? It's something that tastes like coffee. It's not coffee. It's made with, it's a roasted grain. It's got roasted barley extracts, roasted rye, roasted chicory, and roasted dandelion root. And they're extracts. So basically, they break it down. How do they do it? I don't know. Are they boiling it and then taking it out of the steam? Or are they? I'm not really sure how they make it. All I can tell you is it's fabulous. Dandy, love it, love it, love it. Hi, Jessica. Peggy says, what do I think about lactobacillus vaginal suppositories? Many UTI thought that it might help, or does that not work and it's just a gimmick? Well, you know, if you've been on a lot of antibiotics for one reason or another, we know that your bacterial biome is compromised because the antibiotics is like taking a flamethrower to a tropical forest. It kills everything. And so repopulating that area with good, healthy bacteria makes total sense. Do I think it's going to help IC? Absolutely not. And this is the mystery of pelvic pain. Again, a lot of us turn to the concept of infection first, but when the infection is ruled out, then we have to look beyond that. Is your vaginal symptoms because of estrogen atrophy, or is your vaginal symptoms because of tight pelvic floor muscles? Or if you feel a heaviness in your pelvis, like you're carrying a bowling ball around, we need to look at your blood vessels. Do you have pelvic congestion syndrome? Endometriosis, all sorts of other things can cause this. Hi, Marcia. You guys like my little Christmas display? Hi, Gay. Nice to see you, hun. I love the holidays. You know, my I'm kind of in this weird space now where because my parents are so old, I mean, my dad just turned 100. I'm always thinking, could this be his last holiday? He's pretty damn stubborn. It might not be. He could probably live a couple more years. But I always go over the top because I really want to try to make sure that if it is their last holiday, that it's a really good one. And so I decorate like mad. My house is decorated everywhere. I even have snowflakes hanging from the ceiling in our entryway. And I love things that light up. I love things that light up. So I have a lot of signs where you put batteries in and they light up and stuff like that. Becky says, what kind of doctor diagnoses pelvic congestion syndrome? It's actually an interventional radiologist. It takes a special type of radiologist. He's known as an interventional radiologist to find and diagnose pelvic congestion syndrome, although it can also be found sometimes on an MRI or a CAT scan. Mary says, thanks, Jill. Can Mesnex help when my chemo ended in 11? No, probably not. Probably not. All right. Why is this keyboard not working? Oh, well, my keyboard is now not working on my streaming computer. Oh, the joys of technology. Lori says, Dandy Blend is the best coffee replacement available. She highly recommends it to anyone needing to move on from acidic coffee. Great. I'm really, really glad you like it. Caffeine capsules scare me. She says she adds a caffeine capsule in the morning. I could not do that. My heart is way, 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 way too sensitive to caffeine. So you could not pay me to touch caffeine or chocolate or oatmeal or cabbage or Brussels sprouts. Those are my bad foods. My body does not like those foods at all. Yeah, Becky, go for it. Absolutely go for it. Any other questions? Come on, you guys are being easy on me today. You're being very easy on me today. But it is coming up to the holidays, and we all need to be doing holiday stuff for the next couple of weekends. You know what? Let me look. Hold on a sec, because I know that there was one other thing that I thought you would find very interesting. Is that it? You know, Ravonda said, I called Sister Project and asked questions about the inactive ingredients. Guess who called me back? Dr. Theoharides about fainted. He's so nice. He's a lovely man. He's a lovely man. He's truly dedicated to trying to help IC patients. And he just retired from Tufts. So he's now living down in Florida and is playing a much bigger role in the company now. Sue says, if you're having a good week, is there any alcoholic drink that is not too triggering for the holidays? Well, we kind of have to go back to our research on that. IC patients do better with low acid wines. So if you're going to do a wine, I would make a wine spritzer with ice in it. And maybe do a Chardonnay or a Merlot, and then maybe do some pre-leaf with it and chase it with a glass of water. I would stay away from champagne entirely. Champagne is brutal. Champagne is champagne is hard for people who are acid sensitive and alcohol sensitive. If you're going to do a beer, you definitely want to go with a pale ale as compared to a brown beer. Like, I love Guinness. I love warm Guinness. I love the flavors of warm Guinness, but I might have one Guinness every 5 years. Sue says champagne and beer kill me. Yeah. In terms of the hard alcohols, sake was by far the most bladder friendly. As compared to a browner alcohol. And I would look for hard ciders. Look for a pear hard cider or an apple hard cider or a berry hard cider. But again, on ice, chase it with water, try to dilute the effects of it, right? I had a very, very difficult conversation with an IC patient on Friday. And this is somebody that I had worked with before. And it's worth talking about. Remember, in our subtypes, we have these very clear differences. And we're always trying to find causation. We're always trying to find the underlying problem so that we can fix the underlying problem so that you don't have symptoms. We don't want you to just chase the symptoms for years and years and years. And this is a patient who is a very clear surgical injury patient. So she had a mild prolapse, and her doctor said, we need to fix this. And when she woke up out of surgery, she was unable to have a bowel movement, even to this day. And she called the doctor very quickly and said, I can't go to the bathroom. And his answer was basically, what do you want me to do about it? The surgery failed. That's exactly what he said. That's exactly what the doctor said to her. And some funky grafting materials were used. This is back in the days when, mesh was used. And there are just kind of like two things going on. Number one, she can't get a clear answer from anybody about what happened in the surgery that made it impossible for her to have a bowel movement. I mean, obviously something happened. Obviously a nerve was damaged. There's no doubt about that. She had normal bowel movements before the surgery, post-surgery, can't do anything. And she's gone from doctor to doctor to doctor, seeking help. And she is grieving like, it's been 20 years now. She is consumed with grief and anger, as she should. I mean, she has a right to be angry with what happened. She has a right to be angry that the doctor that she trusted basically didn't help at all. And my heart struggles for patients like this because we can't go in and fix that. But the other challenge here now is that she won't let anybody look. It's like, you can't, no, nobody's looking. She's been homebound for 20 years, and she is afraid to let anybody do anything. It's like, you hurt me then. How do I know you're not going to make it worse now? And I was telling her the story of this patient who had a severe prolapse, and she had Hunner's lesions, and that when they went in to repair the prolapse, they found that her uterus was swinging on one ligament, that her back of her uterus was facing front of her uterus was facing backwards. And that when they properly anchored her uterus and got it in the right spot, and they got the ligament reattached, all of her symptoms went away. And I was describing that to her, and she says, well, I can feel things moving. And I'm like, okay, well, this is actually quite encouraging then. But she won't let anybody try. She won't let anybody try to fix whatever's going on. And I understand that. Pamela says my story is very similar. I understand that fear, because I used to have terrible panic attacks going to my urologist, because it felt like every time I went to the urologist, he hurt me. But I also knew that I needed care, and that I would not get better on my own, that I needed somebody to guide me. And so I've shared this before. I took an anxiety management class, and that's really helped me get over that fear. I don't want you to give up. I think she's given up. I don't want you to give up. If bladder therapies are not working, what do the AUA guidelines say? Stop what you're doing, take a step back, revisit the diagnosis. What have we missed? What have we missed? Hold on. We have somebody selling love from an AI device in our YouTube chat. You're the boss. The doctor is not the boss. You're the one that's supposed to be directing your medical care. If there is room for improvement, then it's okay to think about other things that you can try. What have we missed? If you've done bladder therapies and you've peaked out at bladder therapies, Okay, don't assume that you're going to do more bladder therapies. Let's make sure that your pelvic floor is healthy. What about physical therapy? That might be a missing piece. So I guess what I'm trying to say here is that I want you to be as bold as you can be. Be bold, and mighty forces shall come to thy aid. If you're not improving, take a step back and ask yourself, what could we have missed? Or what did I choose not to do that might have been healthy? Some of you don't want to do physical therapy because you don't want somebody's finger in your vagina touching things. But here's the reality. Tight pelvic floor muscles are found in 85% of IC patients. 85%. The great majority of you are hypertonic pelvic floor patients. The great majority of you have tight pelvic floor muscles. That is our biggest subtype. The bladder wall subtype's actually small. And so be willing to try new things. If you have questions, ask them. Take the time to read about it. We've got great books on pelvic floor physical therapy. We've got, Breaking Through Chronic Pelvic Pain is phenomenal. It's just my favorite book of all time, ever. I'm always happy to take your questions. I'm always happy. My job is to educate you, inform you, give you new questions to ask you for your doctor, because obviously I'm not a doctor. I don't give you medical advice. I'm an educator. And part of my job is to kick you in the butt and get you back to your doctor with a new set of questions. And if your doctor isn't willing to try to answer those questions, then it might be time to find another doctor. It might be time to see a different doctor. Some patients, I was surprised. I was working with another patient who didn't have a gynecologist. Well, who does your gynecological care? My primary care. But who does your pelvic? So I don't really get pelvics. Okay. It's important for women to have a gynecologist. And they're the ones who can really help you with the estrogen atrophy and skin health and all that sort of stuff, right? Sue says, a lot of my pelvic floor physical therapy is not internal. It's about doing the right stretching exercises and breathing exercises to relax those muscles, and what ones not to do, like Kegels. Yeah, exactly, Sue. That's true. Becky says, I have both pelvic floor estrogen atrophy and chemical irritation from way too much diet soda. I love my pelvic floor PT. I'm so afraid of doctors, but pelvic floor is different. So, Becky, are you off the diet soda now? Because, listen, any chemical damage done from the diet soda should be long healed. I mean, if it's been 3 months, the damage from depending upon what you were drinking, healing never stops. The bladder is always healing. The bladder is always trying to repair whatever damage was done. The question is, what is the legacy of that injury? Okay, so you've 9 years off of diet soda. Great. The legacy here is that the nerves become very, very inflamed, right? That constant chemical drip is just tweaking the nerves every single time, that caffeine triggering the nerves. And you're doing a lot better now than you were then. That's awesome. Awesome. Again, with this woman that I was working with on Friday, who finally shared that she drank 3 energy drinks every morning, I said to her, would you realize that no therapy will work for you? You're just throwing your money away. No therapy can fix your bladder right now, because you're pouring acid on it every day. You're pouring the highest level of acid you can, and you're jackhammering the nerves with caffeine. And again, she was like, what? And I had to explain basic bladder healing. Basic bladder healing. The bladder contains the largest single cells in the human body. These are giant umbrella cells. And so if an umbrella cell is damaged, there's a little tiny stem cell underneath that is the next generation of umbrella cells. So when that big cell is destroyed, it takes 2 weeks for that little stem cell to grow and change shape and fill in the spot. Well, in that 2-week period, it is exquisitely vulnerable to acid. And that's directly from Dr. Anthony Schaefer, who gave a lecture on bladder healing at a National Institutes of Health meeting I was at like 20 years ago. And he flat out said 1 cup of coffee will kill every stem cell trying to repair wounds. And so the patients who suffer the most are the patients who do coffee or soda every day, because the bladder simply cannot heal. You are destroying the next generation of cells every cup you drink. And she was like, well, I'm trying to get off. And I'm like, well, you don't have a choice. You need to get off. If you want to get better, you need to get off. And she's like, okay, you convinced me. And I've had that conversation many times with people on the phone. It's like, oh, that's why. Yeah, that's why. We want your bladder to heal. Your job is to create an environment to support healing. Marcia says, I finally got up the nerve to have a cystoscopy scheduled, and my urologist told me that the cystoscopy with hydrodistension sometimes causes IC to get worse and never get better. Well, Marcia, it depends on how they do it. Now, in the old days, they did what we call high pressure, long duration hydrodistension, where they filled up the bladder with a lot of fluid under very high pressure, and that was quite damaging. Bladders can break open if you do that. But starting in 2011, the American Urology Association says, no, we're not doing it that way anymore. They need to do a low pressure, short duration hydrodistension, which means you use less water under less pressure for a much shorter period of time. And that dramatically reduces the risk of the bladder being hurt. And so, Marcia, you need to ask him about the technique he's going to use. You know, when I had mine 6 years ago after my hysterectomy, and I flat out told the doctor, I said, you know, only if you do it low pressure. I have no interest in you stretching my bladder to any great degree. I don't want any damage at all. And he's like, not a problem. I'm just going to look to make sure we didn't put a suture through your bladder. And he used a very, very small amount of liquid, and there was no bladder damage done. Marcia says, the doctor said she uses the new guidelines, but it can still do that. I did ask. Marcia, I would ask her how many times this happens. Has this happened to a lot of her patients? Because honestly, with the new guidelines, we just haven't been hearing reports of people being damaged by them. I mean, I can't even remember the last time it came up. Becky's, let's see her, hold on. Gay says, a doctor can only give you options. You are the one who has the final decision. Exactly. We have to take our power back. And understand too, in the AUA guidelines, there's only 2 recommendations. If a patient has tight pelvic floor muscle tear, to be referred immediately to pelvic floor physical therapy. And if a patient has Hunner's lesions, they should be treated immediately. Those are the only 2 concrete recommendations, other than, you know, the basic self-help stuff that we all know, diet, et cetera, et cetera. Every other therapy is an option. Whether it be an antidepressant, an antihistamine, Botox, those are all options. They're not recommendations. And we need to understand the pros and cons. We need to understand the risks versus benefits. And most importantly, we need to ask ourselves, will that fix my underlying cause? If I have tight pelvic floor muscles, will an antihistamine fix that? No. If I have Hunner's lesions, will pelvic floor physical therapy fix that? No. If I have Hunner, then what treatments are the correct treatments for Hunner's lesions? Marcia said, the first physical therapist had me do Kegels and it got me in a lot of pain. My new physical therapist wants me to do them too. Only about 30% Kegel. I'm afraid to do them. Marcia, it's about the relaxation phase. If you can contract for a second, but then relax for like 4 or 5 seconds, I think that's probably what they're referring to. The emphasis is not on the contraction, it's on the relaxation. So when I do them, the few times that I do them, I go for a quick contraction just for a second or 2, and then I'm focusing on the relaxation phase. And it's interesting because like I can contract easy. I can definitely feel that getting my muscles to relax is a lot harder. I can contract like that. Relaxation is a slow process because my muscles are struggling with tension, because of a bad SI joint. Becky said she had to wean off slowly the diet soda. I still have to keep up with my physical therapy and my diet, but I can work full time now. Yes, and you had a baby at 39. Oh, congratulations. I'm so happy you're better. Now, wouldn't it have been nice if somebody had told you when you first started drinking Diet Coke that it could do this? If you look at the FDA approval for NutraSweet, it talks about bladder irritation. But it's so sad that the companies don't give us full information. It's like the old cigarette companies, are saying, hey, it's safe to smoke cigarettes. Yeah, right. No, it's not safe to smoke cigarettes, et cetera, et cetera. Debbie said, I heard it's not good if you have tight pelvic floor muscles. It can make it worse. Well, anytime you stretch the bladder and you trigger pain, your muscles are going to get tighter, but it usually subsides in a couple of days. Sue says, a lot of urologists just don't know how to treat or recognize tight pelvic floor muscles when it's causing bladder pain. Look on Jill's site and find a national specialist. Even if you have to travel far, it's worth the trip. And finding the right physical therapist. Kegels will only make tight pelvic floor muscles spasm and get worse. Loretta says, what's my website? IC Network. ICNetwork.org, the Interstitial Cystitis Network. We've been here. I built it in 1994. And we're still rated the top website. In the two peer-reviewed studies, one by Harvard and one by the University of London in England. Yeah, IC Network rated top for the most reliable, accurate, credible, readable. And I'm always working on it. I have a lot of plans for our website in the next 6 months. I'm completely rebuilding it. I'm creating channels. There's going to be 3 options. Newly diagnosed are going to go through their own pathway. Grizzled veteran not responding to therapy, they're going to go through another pathway. And if you're flaring, you're going to go through another pathway. And so it's going to be very, very, very different. But I really want it to be I don't want you to get lost in the information. I want to give you the best information as quickly as possible. Because people don't want to read a lot of stuff now. There's going to be a lot of videos too. So, which made losing my tooth all the more challenging. It's like I don't want to film videos with a missing tooth, which you can't see. Angie said, is it good to ask for an MRI if you're having IC symptoms? Well, I think I like data. I don't like guessing. I like facts. An MRI would certainly give them an opportunity to look at surrounding structures. I had an MRI when I ruptured disc in my back. It's not the funnest thing in the world, but 20 minutes in a little tube while you're hearing loud sounds, as long as you don't have claustrophobia, having an MRI is informative. But I think, Angie, what's even more informative is in your description of your symptom. Remember, when you go to the doctor, you're giving them a roadmap. And the roadmap is your symptoms. You never walk into a doctor's office and say, I have IC. For God's sake, don't do that. That's not helpful at all. And if anything, that will put you into oh God, it's an IC patient. I'll just, give them an antidepressant and Elmeron and send them on their way. I mean, that's the way IC has been perceived in many, many years. And instead, you have to use this as an opportunity to get a doctor to study, or a nurse practitioner to study your body, and your symptoms give them clues on where to look. And so, do you have pain as your bladder fills with urine, or do you have pain after you're done peeing? That's important. And where is that pain? Is it on the left side? Is it on the right side? Is it centered? Is it low? Is it deep? I mean, is it on the skin? Is it internal? And are there any weird symptoms that happen every now and then? Because it's the weird symptoms that usually confirm the diagnosis. It's the weird symptoms that you forget to mention that are really, really important. Like, do you ever feel a buzzing sensation, like you're sitting on a cell phone on vibrate? Or do you ever feel pins and needles? Or do you ever have areas that go numb? Or do you ever have pain that shoots down your leg? Or do you ever have pain in your feet? And also, so incredibly important here, is you telling them about traumas. Did you have surgery? Have you had a baby? Did you ever fall and break your tailbone? Do you have a bad hip? Anything at all like that. And even if it's a trauma 20 years ago, if it involves your pelvis, they need to know about this. So many of you. And again, last week, it was the same thing. It was somebody whose symptoms began, and I said, can you remember any trauma? Take me back 25 years when your symptoms began, in her 20s. Okay. What do you think triggered your symptoms? And she's like, I don't know. I thought it was an infection. I went, okay, so take me back in time. What were you doing back then? Were you an athlete? Yes, I was an athlete. What kind of sport did you do? I was a dancer. Okay. Dancing is a huge risk factor for pelvic floor dysfunction. Just like running, a lot of runners, you may not know that a lot of Olympic athletes, those marathoners, have to run with a pessary inside their vagina because their workouts have been so extreme that they have lost muscle health. And so if they didn't wear a pessary, they would be leaving a trail of urine as they ran. And that's just from extreme workouts. And so many of us, I was a gym rat. I loved going to the gym. I just loved working out. It felt great. I always felt good afterwards. Alexa says, where did you say I could get a next generation? I go to Kaiser Permanente. Okay, so Alexa, Kaiser is a beast. They're literally 10 to 20 years behind, and they have their own way of doing things. I'm a Kaiser patient too. So I can remember, let's see, my urine test, I did not need a doctor's signature back then. But when I wanted to have my vaginal discharge tested, my gynecologist said no. And I said, I'm paying for it. You're not paying for it. It's just data. I'm curious. I would like to see if the next generation test found anything unusual. Is there harm in that? And she said, no. And I said, then why wouldn't you want to sign this? And she was like, well, we just don't really use it here at Kaiser. And I'm like, I don't care if you use it or not. I'm paying for it. I just need you to sign it. That's all. And she's like, okay. And she signed it. And it was fascinating. And I have the results. Hold on. I have the results. I share these. Here, these are the thingies I normally use. Here it is, right here. So I wanted to know why my urine was cloudy. After my hysterectomy, it was like I was peeing cream soup. Like, what the hell? I mean, it wasn't quite that bad, but my urine was very cloudy. Yeah, Alexa says, yeah, I know they're dinosaurs. And Alexa, I got to tell you, I got an email from my primary care just begging us to switch all of our appointments to virtual appointments and to please not go to the ER for minor things. Only go to the ER if your life is at stake. And she just flat out said, we are maxed out with caring for all the kids who are sick right now with the flu and RSV. I mean, my 2 nephews' kids, 105 fevers a couple weeks ago. And the care providers are getting sick, and now COVID is surging again here. And so understand, and please be very gentle with your doctors and your nurses. They're not the enemy. They're risking their life to care for us because they are operating in a pandemic right now. So we all need to give everybody a bit of grace. And that's what she asked for, right? Okay, so anyway, so getting back to the next gen test. So I made the point, I'm paying for it. It was $199. I'm not asking you to do anything. Let's just see if it finds anything interesting. We rule stuff in, rule stuff out. And these are my results. Okay. And so it was for a vaginal swab. And let's look at what it found. Well, the first thing that I wanted to know was there any sign of fungus? And the answer was no, because I just thought it was like candida or something like that. So what did it find in my urine that made this cloudy urine? I had 92% lactobacillus, which is a normal bacteria. It's supposed to be there. I had 3% Prevotella, 2% Streptococcus, and something very, very tiny, Gardnerella. And the nice thing about the next gen test is they look for antibiotic resistance genes. So under this red thing, resistance genes detected. So, and these are aminoglycoside genes, right? Aminoglycoside genes. So the bacteria in my body that it was identifying were completely resistant to that type of antibiotic. And then it gave us the rating on which antibiotics, see there are check marks on which ones would kill it, right? In the end, though, we didn't treat it because my only symptom was cloudy urine. I didn't have increased frequency or urgency or pain. I just had cloudy urine. I just wanted to know why I had cloudy urine. And so I had to make the decision, do I want to disrupt my entire biome to chase this and clear up my urine, or do I not need to treat it? And I chose not to treat it. And like 2 or 3 months later, my urine became normal again. It was just a weird disruption. Alexa says, is it still 200 or more? The last time I looked, it was $199. Let me look. So we're talking about a next generation DNA urine test. If you are absolutely convinced that you have infection, there's one way to prove it. Have a next generation DNA urine test. Here, hold on. You order it. Medicare will pay for it if you have Medicare, but you order it as the patient. And then they send you the kit. It's a tiny amount of urine, like literally this much urine. They tell you how to collect it. There's a form in it that you fill out, and that's where you need your doctor's signature. So if your urologist won't do it, ask your primary care to do it. Most doctors will do it now. I mean, it's just normal. Let's see. Accept cookies? Yes, I want to accept the cookies. I'm a patient? Yes. What is the cost of the test? $199. No. Anne says Medicare covers yes, Medicare will cover next generation. The company doesn't necessarily like to talk about that because it takes them a long time to get paid for it, but it is Medicare eligible now. It is. Hey guys, a quick pee break. I need to go to the bathroom. Let's just give me a minute. I'll be right back. Well, we'll see how tight my muscles are. I'll be right back. You know, right there. So I am happy to announce that my levator and muscles are in great shape, and I peed like a horse, but that my piriformis muscle on my left side hurts like a beast. The piriformis muscle does not control urination. The piriformis muscle is up by the SI joint. Oh, because I have not been doing my stretches. Here, hold on. Okay, let's try it. Oh, God. Oh, that pulls. Woo. Woo. Let's see if I can get it to stretch out. Okay. Oh. And that's just been getting tighter and tighter the last week. I feel it when I get up. You know, it's right around the sit bone, like right there. I need to roll on my roller. Oh, dear gods. What is neurogenic bladder? Neurogenic bladder means the nerves are not working correctly. It just means that they're not behaving normally. That's all. Neurogenic bladder is very difficult because, you know, nerves are very slow to heal. So we have to understand what's going on with the nerves. Is there a disease process that's affected the nerves? Is there an injury that's affected the nerves? If, for example, you rupture discs in your back and you're totally incontinent, then you have a severe nerve injury, and that is a medical emergency. They need to fix that quickly, because if that goes on, we're going to see real long-term sustained damage from that nerve. Sorry for you to hear my slurping, but I have to keep drinking. Alexis says, great, thanks. Oh, my goodness gracious sakes alive. I am wearing a holiday. So I am wearing one of my favorite holiday t-shirts. All I want for Christmas is you. We do. I just really I want you to really just enjoy the simple things. You know, what are our basic holiday survival tips? You know, number one, if you're in pain, don't force yourself. don't force yourself to do stuff. If you're in pain and you need to stay home, it's okay to stay home. That was the biggest lesson for me early on, was to not allow myself to be guilted into doing things when I was in a flare and in severe pain. And when I finally gave myself permission, like at the age of 35, to say, no, I'm going to stay home, that was huge because it gave me control. It gave me autonomy. It allowed me to make decisions about how I was feeling. And I think that that's important. I think it's also important to remember that the best moments of the holidays are not the big things, they're the small things. It's the baking cookies. It's laughing uncontrollably watching a funny movie. It's those small spontaneous moments that make like my grandma Betty made weevil soup one year. She couldn't see well and she made soup and her noodles had worms in them. It had weevils in them. And my cousin Susie, who I love dearly, 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 this was at my aunt's house, was the first to actually look at the soup in the spoon as she was bringing it to her mouth, and she saw the worms. She was like, "What's this?" Everybody looked at their soup bowls. They all had worms in them. And my grandmother didn't just do it once. She made weevil soup twice. She made it twice. And then my legendary moment of tomfoolery was when I made my sister and her young children lasagna. And I forgot to peel the paper off of the cheese. Oh my gosh. Then she called me because she goes, "Did you realize that there was paper on the cheese?" And I was like, "Oh my God." And then my brother's favorite, my brother decided he wanted to make a cake, but he didn't want anybody else to eat it. So he made ugly frosting. He made gray frosting. And we all ate it anyway. Or my sister made cookies with like bacon grease. She was all watching us going, "Is it okay? Is it okay?" And we're like going, "Okay, what's wrong with it?" And it's okay to make new memories. Listen, I've had wonderful holidays, even with pain, because it's about those funny moments. 100 years from now, people are not going to remember if you drove 20 miles. People are going to remember your kindness. And that's really what the holiday should be, is what can you do for somebody in your family that needs a little bit of help? And what can they do for you if you need a little bit of help? Then it's not buying the $200 Xbox. It's about making them cookies or bread. My mother, all she wants is Christmas bread. She just wants Christmas bread. And she loves it. And she has it every morning. She's already having it. And it's like, it's fine. It's fine. So I just truly hope that we can all simplify a little bit this year and just get back to the fun moments. Oh, and Sue says, my son made Thanksgiving popovers. Instead of using flour, he used sugar. And he was the one who insisted on the popovers. I told him not overdoing it this year. If you want them, you make them. He makes really good popovers. It's his favorite food group. Yeah, why not? Why not? I love fruit soup. Again, as you can tell from my decorations, we're Norwegian and Swedish. And so we have a lot of Swedish traditions. And I'm not going to eat a lutefisk, which is stewed whitefish. That's disgusting. No. But we love fruit soup. And fruit soup, my mother and I love fruit soup. And it's a fruit that's been boiled. And you've got apples in it and pears in it and peaches in it. And you can put prunes in it. You can put raisins in it. cinnamon stick, and you boil it for like 4 hours. And then you put a little tapioca in it, and you serve it cold with whipped cream, and it's just to die for good. We love it, but that's our taste. Some of those fun traditions, you know. Over on the IC Network website. Oh, actually, here, hold on. So again, in our latest magazine, and if you're members, you should have gotten your magazine. If you haven't, let me know. If you can always go to your member page and read it too on the IC Network. I shared some of my best approach to the holidays this year, an IC-friendly approach to the holidays, because we are slowly coming back from this COVID zone, although this is going to be a difficult year, obviously, because we're in a quad pandemic, a quadremic right now. COVID, RSV, flu, and then there's something else that's going on that they haven't figured out yet. Okay, so number one, perfect. Don't try to be perfect. You don't have to be perfect. It's okay. Perfection is not an option. Take all the stress off the table. If you expect to have a perfect holiday, perfect children, perfect gifts, perfect health, and perfect friends, you'll be in for a major disappointment. Give yourself permission to say no. The thing about holiday parties, and especially if you're going to somebody else's house, and you're not sure if they're going to have some food that you're going to be able to eat, it's okay to eat before you go. And we have some ideas on things you can do. Don't carry all the weight for the holidays on your shoulders. It's very, very important that you teach your children and you role model to the children that if somebody in the family is sick, we help them. We help them. We don't expect them to do everything. If mama's sick, we step forward and help. So don't allow your family or yourself to put all the burden of the holidays on your shoulders. From cleaning the house to wrapping packages, let everybody know they need to carry their fair share. Even young kids can put dishes in the dishwasher and straighten up the bathroom. And then I think one thing that I think is really good is, yes, we have these massive traditions, and some people feel like it's a failure if we don't do everything, but that's really not fair to the next generation. I think we need to ask everybody in the family, what is your favorite tradition? What is your favorite tradition? What is your favorite tradition? And then pick one tradition for every family member and make it happen. So if one person wants to make cookies, great. If one person wants to have a snowball fight, perfect. If one person wants to sing Christmas carols, fine. You can sing a couple of Christmas carols. But the gift is that we get to create new traditions. We don't have to be burdened by things that happened in our childhood that maybe we didn't like. That doesn't mean that we have to do that in our homes. And really the gift of being the next generation is we get to look at what our parents did that we didn't like, and we don't have to do that anymore. We get to do something new. And for some people, their new is to not even be home. It's to go to Hawaii. For others, it's to celebrate Christmas in January. It's okay. Just be flexible. Getting out in nature, it's amazing the research that shows how much more healthy we are when we get outside and we get into nature, and what that does for our brain in terms of resetting our nervous system. And I think it's important that we understand, that you understand that you have worked your ass off since IC. You have done everything you can and more to try to figure out why you're struggling, and you're still keeping the house running, and you're still working, and you're still doing this, or being a mom or being a daughter or whatever. And you've worked so hard. And the thing is nobody knows how hard you're working because they don't have IC. But we know how hard you're working. We know how hard it is to get up to Try to work during the day when you've been up in the middle of the night. And so reward therapy is so important. What can you do to reward yourself for all this effort? Not only to pat yourself on the back, but you deserve something. You deserve something. So our reward in our family is if anybody goes to the doctor or the dentist, we get Dunkin' Donuts. And I'm not a donut eater, but you know what? I'm all in. My dad can have whatever he wants. He's 100 years old. If he wants Dunkin' Donuts, I'm getting him 100 Dunkin' Donuts. For me, reward therapy is after dinner, sitting by the fire with a book and drinking and just chilling out or watching TikTok for an hour. Just I want you to reward yourself. I want you to acknowledge that you have worked very, very hard and you deserve better than you have. And so don't beat yourself up. Be proud of what you've done. It is hard to pick yourself up by the bootstraps when you're in agony and ask for help, but you're doing it. And you're coming to meetings like this. You are invested. You want to get better. But take some time for you, whether it's taking a warm bath, whether it is calling a good friend, whether it is just getting outside for a couple of hours and watching ducks swimming on a lake, whether it is watching the snowfall, reward yourself, right? We all need that. Sue says she's never heard of fruit soup. Yeah, Scandinavian fruit soup. It was passed down by my family. We have Scandinavian fruit soup, and I make my great grandmother's cardamom Christmas bread. That's what I do in my family. That's my tradition. And I never quite know if people like it, but I know I like it and I know my mom likes it. So you know what? It is what it is. Turn on the music. Alexa says, I love that. Definitely about precious moments. I have a precious moments nativity set. My dear friend Diane, who helped me start the IC network, she had hundreds and hundreds and hundreds of precious moments. Her whole house was precious moments. It's amazing. She had one of the largest collections in the country. She said, I would give anything to have my mom and dad and eldest brother with us again. The holidays can be difficult for sure. Yeah, they can. They can. But in the end, it is still a day, and we will have more days. And as long as we spread that kindness and that love, and just remember that 100 years from now, nobody's going to remember money, and nobody's going to remember any of that. They're just going to remember how you helped. And so just try to be helpful. Try to call grandma. Please call your grandparents. They're so lonely. They're so lonely. They're desperate to hear from you. They're desperate to hear from family. I know this because I'm caring for them. And it's hard when the next generation just forgets them. They might check in once a year and come on, guys, once a month, just a phone call for 5 minutes. Just say hi. It would be great, right? All right. Well, listen, let's just do a last call for questions. You guys are very easy on me today. I need to go do some shopping. So if you're done with me, I'll go shop for my parents. Last call for questions. Otherwise, hopefully I'll be back on Thursday or Friday for Facebook and Instagram, on Sunday for the big meeting. And I intend to do them throughout the month. But let's look at the schedule here real quick. Honestly, I don't even know what days of the week. Oh, Angel, you're welcome, hon. I'm happy to be here. I like talking to you guys. So hold on a sec. What? Okay, so Christmas Day is on Sunday and New Year's is on Sunday. So our last Sunday meeting will be the 18th. But I will probably try to do a couple of drop-in meetings if I can. Otherwise, I will be So I should be here next Sunday. I should be here the Sunday after that, the 18th, and then January 8th would be our next our. So there's going to be a good 3-week break in there from the Sunday meeting. Marcia says, enjoy time with your parents. I miss mine so much. I do, hun. I do. It's hard though, because honestly, I'm exhausted. Like last night at 1 a.m, I was cleaning. I am like the family workhorse right now because I work full time with the IC network and I work full time 24 hours a day with my parents. And so I want to spend time with them, but honestly, there are times, like especially around dinner, where I just have to go into another room with my food and just read and just take a breath. I think, as Sue says, I think that's where everybody else is doing today, putting up Christmas decorations. Absolutely. I wish I could show you. I wish I could show you my my Christmas tree. I'll take some pictures. My home is decorated to the nines, and I love it. It just makes me happy to do it. So once they're gone, I'm still going to decorate to the nines because I love it. It makes me feel good. So, all right, you guys. Well, I think we'll call it here. Be well, my friends. As always, if you want to talk, you're welcome to call the IC Network. ICnetwork.org. The phone number is on the top of the page. You're welcome to email me, icnetwork@mac.com. icnetwork@mac.com. So I hope that you can make a fun memory tonight. And I hope somebody bakes some Christmas cookies this week. All right. I'll talk to you later. All right. YouTube is done. All right, Facebook.